Hello everyone, and welcome back to another episode of Ask the Doctor. Today we're discussing hip and knee replacements. And with me is Dr. Anuj Gupta, a total joint specialist with Northside Hospital, Cherokee. Welcome in, doctor. To start, what is the difference between an anterior and a posterior hip replacement?
This is a model, a schematic of a pelvis. So if we look at it, this side of the pelvis shows the muscles and everything incorporated. This side of the pelvis, the plastic, really just shows what the bone looks like. So the difference between an anterior versus a posterior hip replacement is going in through the front for the anterior or going in through the back for the posterior hip replacement. You can see how much more muscle there is on the back side of the hip. This is the gluteus maximus, the gluteus medius is over here. We actually have to split this muscle in order to get into the hip from the back. When we go in through the front, this is going to look a little bit odd because I'm not actually removing the muscles when I do the surgery, but basically we're going between these two muscles here to get into the front of the hip joint. So you don't cut anything off of the bone. So the muscles just fold back where they belong after the surgery is done, and it's like you were never there. There are advantages and disadvantages to both types of hip replacements, but I would say in general, anterior hip replacements have more advantages than posterior hip replacements. Primarily, with an anterior hip replacement, you don't have to remove any muscle from the bone. It is a smaller incision, it's less invasive, typically it's a quicker recovery, and patients feel like it's a more natural hip. Posterior hip replacements are very good for complex procedures where you need to have more exposure, but it comes at the cost of stability of the hip joint, so it's more likely to dislocate, and that can be a problem if that complication does occur. At a year, most patients do about the same. There's really no noticeable difference between an anterior versus a posterior hip replacement at 1 year from surgery.
Why would someone need a posterior hip replacement?
There are some circumstances where a posterior hip replacement makes sense. So if there's a severe deformity or you need to have a lot more exposure, a posterior hip replacement allows you to make the incision as long as it needs to be. So you can get a lot more exposure. Of course, the downside with that is that since it's a longer incision, there's usually more blood loss, there's usually a higher risk of infection, and it destabilizes the hip joint. The hip joint can pop out of joint. But in some cases, those are necessary evils in order to accomplish what the objective is.
How can knee replacement pain be managed?
So knee replacement surgery is one of those really painful operations, at least it used to be. I used to refer to it as the white knuckle operation. So I would go in and make rounds on my patients following the surgery the next morning, and they'd be grabbing their bed rails, white knuckled, holding on for dear life because it was so painful. Over the recent years, we've actually done a really good job of managing pain. So we're actually much more proactive about pain, and we block pain before it ever even happens. So patients get nerve blocks prior to the surgery. So when the anesthesia wears off, those nerve blocks are blocking the pain, but don't block the muscle function. So you can get up and start walking right after the surgery. This is one of the reasons why patients are able to go home the same day after knee replacement surgery.
How long do joint replacements last?
Joint replacements last a very long time. There's a lot of misinformation out there with regard to how long joint replacements last. Typically, patients come in and say, "So doc, it's going to last about 10 to 12 years, right?" And my answer is no, that's not right. They actually last a lot longer than that. A good joint replacement can last easily 25, 30, 35 years. I've been doing this for 22 years now. I've never had a knee replacement or a hip replacement wear out. The materials that we use nowadays are so much better than they were in the past, but some of it also comes down to how well is the joint replacement put in. If it's put in properly, it'll last longer. It's kind of like the alignment of the front wheels of your car. If your wheels are aligned properly, the tires will last longer. So if the joint replacement is put in properly, it will last longer. Some of it also comes down to how much you abuse your joint replacement. So if you're a marathon runner, it's probably not going to last as long as the person who's out playing golf on the weekends. So those three factors really are what make the impact with regard to how long it will last.
What are the risks of joint replacement?
So anytime you do surgery, there's risk. There's no such thing as a risk-free operation. But specifically as it relates to joint replacement, there are two really big risks that we really want to prevent from happening. The first is infection. So we do a lot of things to prevent infections from occurring. You'll find that in the operating room, your entire surgical team is wearing a spacesuit. So it prevents things like hair and skin particles from ending up in the surgical wound and causing infection. The other ways that we prevent infection are using, of course, sterile instruments, very clean environment, but in addition, we give patients antibiotics before and after the surgery to decrease the risk of infection. The risk of infection is way less than 1% for a normal, healthy individual. The other big risk is blood clots. Blood clots can be dangerous if they break off and go to the lungs. That can actually prevent oxygenation of the blood and can lead to very serious complications, including death. So we prevent blood clots from occurring by putting patients on a blood thinner after the surgery. So usually we just put patients on a baby aspirin twice a day following the surgery to decrease the risk of blood clots. It virtually eliminates the risk. It doesn't completely eliminate the risk, but it greatly diminishes the risk to less than 1%.
What will I be able to do after joint replacement?
So the whole point of doing joint replacement surgery is to get you back to life. So if you like to travel, then you can travel. If you like to play golf, you can play golf. Basically, you can do just about anything after joint replacement surgery that you were able to do when you were younger or didn't have arthritis in your joint. So for instance, you can play tennis, you can go hiking, you can go to the gym and do weightlifting, you can go for a jog, you can go swimming, you can ride a bike. All the things that give you that quality of life that many people are looking for is what you can do with joint replacement surgery.
Are you accepting new patients?
At this point in my career, I'm actually practicing at Northside, Cherokee, and my doors are wide open for new patients. I love taking care of people with hip and knee arthritis. It's all I do day in and day out. The best part of my day is having patients come back after surgery and tell me how great they're doing and how many more things they are able to do with their lives, whether it's traveling or playing golf or whatever is important to them.
This has been Ask the Doctor, presented by our friends at Northside Hospital, Cherokee.